Telemedicine, Transforming Healthcare. This presentation was created by Group 1 in Information Technology for Healthcare Administration by Vala Jamison and Kayla Ward. When a patient is sick, going to see a physician can be a huge inconvenience, especially if you live in remote areas where the care needed from a specialist could mean driving for hours in order to receive the needed care. Sometimes providers are unable to spend the quality time needed with each patient, and all too often the response time needed in treating a patient to prevent adverse effects from the illness is extremely short, such as with stroke patients. Telemedicine is transforming the way in which providers spend time with their patients to provide both routine and critical care. During the next 10 to 15 minutes, we will preview a video of how telemedicine works, define telemedicine, discuss privacy and security, standards of care, physician disclosure, patient records, benefits of telemedicine, the patient experience, legal issues, and look at an example of how telemedicine is used in the ICU. The video in the next slide will give a brief overview of how telemedicine works.
So let's get vital signs on him, get a blood pressure. Hey Don, can you squeeze my hands real hard? Jane is going to start an IV in your left arm here, okay? Has he had a CAT scan yet? Okay, good, good.
When it comes to stroke, time is critical. Within minutes, there's permanent damage to a patient's brain.
For every minute the brain is deprived of oxygen, 2 million brain cells die.
Telestroke is the opportunity for stroke experts to provide care to patients at the point which they present, so they don't have to be transferred up to Portland to get that care. Telestroke transports us into the emergency room to take care of those patients in remote facilities. Hi Don, this is Dr. Okan.
Hi Dr. Okan. He's got right-sided weakness, a right-sided facial droop. He's got some expressive aphasia.
So this way we can have the total visual presence of the physician we're talking to in Portland be right here with us and really help us make decisions that can be critical to the care of the patient.
This gizmo is our stroke robot. Hey Dr. Okan, this is Don. He's one of our employees at the hospital, and he developed stroke-like symptoms about an hour ago on his right side of his body.
Okay Don, I'm going to ask you to do a few things now. Can I have you open your eyes real wide? Real wide. Can you put your arms up for me? Hold them up like you're holding up a platter. Hold them up there. Can you get that right arm up? All right. Okay. By transporting us essentially into the room of patients, we can see them, examine them, talk to their family members, talk to the providers, and work with their providers, look at their CT scans as if we were there providing care to them, saving hours of brain.
Telemedicine is the use of telecommunications technology to provide, enhance, or expedite healthcare services, as by accessing off-site databases, linking clinics or physicians' offices to central hospitals, or transmitting x-rays or other diagnostic images for examination at another site. Patient privacy and information should be protected at all times. The same protocol used for protected health information should be used with devices and software applications which are utilized for telemedicine. Providers are held to standards of care for face-to-face interactions with patients, and they should be held accountable for upholding the same standards when using telemedicine for patient care. If a patient needs a referral for additional services such as labs or x-ray, the telemedicine provider is responsible for making referrals for specialized services. Telemedicine providers should schedule follow-up care as necessary for patients the same as they would for a patient being seen in their office. The Louisiana Board of Medical Examiners requires that physicians disclose certain information to patients before providing telemedicine services. Under current board rules, a physician must disclose to the patient the name, Louisiana medical license number, and contact information of the physician's specialty or area of practice, how to receive follow-up and emergency care, how to obtain copies of medical records and/or ensure transmission to another medical provider, how to receive care in the event of a technology or equipment failure, and notification of privacy practices. Telehealth visits are documented in the patient's electronic health record, the same as face-to-face encounters. The adoption of the electronic health record has helped to bridge the gap, which was previously one of the limitations of moving forward with telemedicine. Providers now have access to patients' records, and there is no longer the need to be in the office with the paper chart to know the patient's previous medical history. A patient who has established a relationship with their primary care provider can now have the primary care provider with them during the consultation with a specialist. The electronic health record affords the specialist the opportunity to review a patient's medical history. However, the primary care provider who already knows the patient can provide input regarding the patient's medical history during the consultation. The primary care provider can now receive real-time feedback from the consultation visit and will no longer have to wait for an office note to be faxed or sent via an interface. The reduction in travel time will help to reduce the no-show rates, improve availability of same-day appointments, and attract new patients. The patient experience will be enhanced by having providers readily available, and improved patient outcomes will result from patient compliance and the ability to communicate directly with the primary care provider when giving real-time feedback. The Association of Medical Colleges has made forecasts that there will be a shortage of 90,000 U.S. doctors by the year 2020. There is no longer a need for patients to drive long distances for care. The off-site providers usually communicate with an on-site provider through electronic media. The recommendations of care can be made directly to the on-site provider, which saves valuable time for stroke and ICU patients. Stroke victims often need to receive immediate care to prevent the paralyzing effects of a stroke. When providers remote in to see patients, they are able to perform physical examinations the same as they would face-to-face with the help of the on-site provider. "30 states require private insurers to cover telemedicine the same as they cover in-person services. There are 200 telemedicine networks in the United States and 3,500 telemedicine service sites. The Veterans Health Administration administers more than 300,000 consultations using telemedicine each year. Technology and intensivists. A telemedicine type application bridges the manpower gap by creating networks of ICUs and linking them to centralized command centers that are continuously staffed by intensivists and support personnel. Technology tools such as e-care manager, algorithms, smart alerts, and smart reports are used both on-site and at remote locations to help make healthcare delivery better and safer. E-Care Manager is a physician-focused ICU electronic medical record and tool for executing routine tasks. For example, monitoring, note and order writing, care planning, and communication. Algorithms help providers deal with a specific patient. Smart Alerts function as an early warning system. It remembers clinical data such as vitals, medications, and lab results. Smart Reports provide detailed information about outcomes, practice patterns, and operations. The next video provides an example of this concept. The mortality rate for ICU patients exceeds 10%, and the daily costs are 4 times higher than those of other inpatients at a hospital. ICU patients experience a high incidence of medical errors, equal to 1.7 per patient per day, and because of their inherent instability, they are particularly vulnerable to harm from suboptimal care. With improvements in how healthcare is delivered, it can lead to improvements in outcomes, both clinical and financial. Centera Healthcare is a 6-system hospital in Virginia. The eICU program has been up and running since 2003. One study with Centera Healthcare showed a 25% reduction in hospital mortality, a 17% reduction in ICU length of stay, and a 13% reduction in hospital length of stay with the use of telemedicine. As an example of telemedicine, the eICU program is just one of the great technology innovations that will make healthcare better and more efficient for patients. Providers are often hindered from treating patients remotely when it requires them to cross state lines. Representative Devin Nunes and Frank Pallone have introduced the Telemedicine for Medicare Act of 2015, which would permit Medicare providers licensed to practice physically in one state to treat patients electronically across state lines. Many Medicare patients, often due to medical, transportation, or financial restrictions, are unable to travel long distances to receive care. This bill brings the doctor to the patient wherever they may be to help ensure all Medicare beneficiaries have access to care. When an alternative service covered by the Medicare program is available, non-covered services to program beneficiaries are prohibited. The privacy and security platforms for telemedicine must support several privacy and security principles, which includes confidentiality, integrity, and availability. Confidentiality ensures that transmitted and stored data cannot be read by unauthorized parties. Integrity ensures that there are no intentional or accidental changes to transmitted and stored data, and availability ensures that users can have access to assets or resources regardless of location or time. In conclusion, telemedicine is changing the way patients and physicians interact with each other. There is no longer a need to practice medicine only in the office with face-to-face interactions. Patients who live in remote areas or those who need access to emergency care can now receive consultations or receive one-on-one care from a specialist who is not bedside. The Telemedicine Act of 2015 allows for remote access to care with qualified providers while ensuring that medical information is protected through security platforms. Gone are the days of being forced to sit for hours in an emergency room waiting to receive care. Stroke patients and ICU patients who must receive specialized care benefit from having a provider call in remotely to examine them and offer expert advice to a bedside provider. Telemedicine saves valuable time and ultimately saves lives due to the quick turnaround time available, which would have otherwise been lost in travel. Patients can receive expert care from the specialist during consultation while still receiving support from their primary care provider, someone they trust and who knows their medical history. Telemedicine is changing the future of healthcare.